Hello students, my name is Kirsten Scott and I am the teaching fellow for this course and absolutely honored to be joined today by the Honorable Minister of Health of Rwanda, Dr. Agnes Binagwaho. So really just to get things started, I think it will be helpful to have some more context with respect to where you call home.
Where I call home, home is Rwanda. Mm-hmm. And I was privileged to come back in Rwanda and work as a pediatrician, because I'm a pediatrician, in 1996. It was 2 years after the genocide against the Tutsi. Mm-hmm. And at that time, the country was still totally destroyed. We were 6 pediatricians for a population of around 10 million. And there were no drugs. Infrastructure were destroyed across the country, as I told you. The morale of the health workers was not there because, mm-hmm. and the trust of the population was not there too, because health professional has contributed in the killing. Mm-hmm. And also, so people were not feel safe in one hand, but also there was at that time no possibility to give continuous quality care according what we know. That means the knowledge, the science, and mm-hmm. evidence that has been built across the world. Mm-hmm. What we have to do, we were not able to do it. But mm-hmm. not only that, because a doctor can do nothing alone. Mm-hmm. We need to work with nurses. We mm-hmm. we need infrastructure. And as I told you, the knowledge of the people that were working in hospitals was so little, you know, mm-hmm. that we were losing a lot of children just because the basic science, the medical science, were not integrated. Mm-hmm. So not only it was not, we were not in a condition to provide care, but the little we were providing altogether was absolutely out of standard. And it was all a process to rebuild everything. In fact, the entire system, it was really out of standard. Mm-hmm. And you can imagine, you cannot create a society oriented to people when you plan to kill out of a big part of them. So since the year 60, when Rwanda was independent, the number of doctors educated was very few. Mm-hmm. There were no nurses who have a degree. It was a lower level of secondary school. There were no books. We just mm-hmm. managed to build the first library 2 years ago. There were no real teachers in the university. Mm-hmm. It was people teaching like that, or foreigners coming and teach. Mm-hmm. So we didn't build the capacity to provide social services to our own people. And the little that we had has been destroyed, and the people killed, and the people out. So that's the context when I came, in a country devastated by the genocide against mm-hmm. the Tutsi, by HIV, by malaria. So it was really a piece of land where nothing was working.